Hi, my name is Jabria Hill, and today we're going to be doing a video over RLS and PLMD. RLS is restless leg syndrome, and PLMD is periodic limb movement disorder, and both of these are a type of sleep-related movement disorder. RLS is the irresistible urge to move your body in an effort to stop the odd and uncomfortable sensations that occur in your legs. Now, patients with RLS often describe the sensations as a creepy, crawly, itchy, tingling feeling. Some of the things that are done to ease the sensations that occur in your legs due to RLS is rubbing your legs, maybe stopping your feet, getting up to walk, or even exercising. Now, RLS is known to occur mostly when your body is in a state of relaxation. So if you're like watching TV, reading a book, sitting at the table eating with your family, or even trying to sleep, that is when RLS is going to occur versus when you're being active. Now, RLS can occur at any age, including infancy. Usually, children who have RLS are misdiagnosed as hyperactivity because they're trying to get rid of that sensation in their legs. They're going to move around a lot. However, the onset of RLS usually occurs in early adulthood and stays throughout life, and it affects about 5% of the population. There are also some medical conditions that are associated with RLS as well, and some of these medical conditions include OSA, which is obstructive sleep apnea, diabetes, rheumatoid arthritis, and Parkinson's disease. There are ways that RLS can be treated, and one of the ways is through medications. Now, there are some medications that you do want to stay away from when trying to treat RLS, and these are antihistamines, antipsychotics, or antidepressants. Now, some of the good medication you can use to treat RLS include Requip, dopamine agonists, or opioids. Now, as the patient, say you were the patient and you were feeling or having any of the symptoms of RLS, you really want to let the sleep technician know about these sensations in your leg and your symptoms. Now, as a sleep technologist, you want to make sure you write down and document everything that the patient says and the symptoms that they have relating to RLS, so when you give it to the physician, they have accurate information in order to diagnose RLS. Anybody who has RLS most likely has PLMD, and as I stated before, PLMD is periodic limb movement disorder or periodic limb movement in sleep, or Plmd. It is when your body involuntarily moves while you're asleep. Like, you don't even know that you're moving in your sleep. You're just asleep. All you know is that you're asleep, but you do not know that you're moving. However, your movements in your sleep affects your bed partner, because you may be kicking your bed partner, and that is affecting them, and it is also affecting their sleep. The periodic limbs movements that occur in your sleep are repetitive movements, and they occur in periodic episodes. They are mostly seen in stage N2, and they affect about 1/3 of the population of adults who are over the age of 60. Some of the common symptoms of PLMD is daytime sleepiness, frequent EEG arousals, and fragmented sleep architecture. There is also some ways that PLMD can be treated, and it is also through medication, and some of the medications are benzodiazepines, which is the most common, and this suppresses muscle attraction. Then you have dopaminergic agents, which regulate muscle movement during sleep, and then you have GABA agonists, which help relax your muscle contractions. That is all I have for you on RLS and PLMD. If you are having any symptoms of PLMD, then you need to speak to your doctor, as well as any symptoms of RLS, you need to also speak to your doctor. And once you speak to your doctor, they may refer you to a sleep specialist, and you'll probably have to come in and do a sleep study so they can monitor you and watch you throughout tonight to see if you move or whatever kind of movements you make, so they can make an accurate diagnosis of whether or not you have RLS, PLMD, or any type of other sleep related movement disorder.